Hello all, myself Helena Joy, lecturer from SNS College of Allied Health Science, Department of Radiography and Imaging Technology. I am going to discuss a topic about mammography. Mammography is a radiographic examination of breast. It helps to detect breast cancer early and reduces the mortality rate for women of age above 40. Breast cancer is the leading cancer in women, and in India, 1 in 22 women may have the chance of getting breast cancer in her lifetime. Anatomy of the breast looks like this. It has of chest wall, blood vessels, mammary ducts, nipple, fat cells, intercostal muscle, pectoral muscle and rib bone. Types of mammogram: screening mammogram and diagnostic mammogram. In screening mammogram, it is performed in asymptomatic patient, and in diagnostic mammogram, it is performed on high-risk patient or patients with symptoms. Indications and contraindication. Indication: pain, swelling, nipple discharge, calcification, benign or malignant tumor, lymph node enlargement. Contraindication: inflammation, breast implant, severe nipple discharge, large palpable mass. Mammographic equipment consists of high frequency generator, molybdenum target, filament, filter, grid, compression device, automatic exposure control. Mammographic equipment. We'll just discuss about in detail. Generator. High frequency generator is used on a single phase. They are smaller in size with good reproducibility and capable of providing tube current up to 600 MAs. Target: molybdenum and rhodium target material is used. Filament. It is positioned with a focusing cup with two focal spot sizes, namely 0.4 mm and 0.1 mm. Filament types are either double wound filament or flat ribbon filament or circular filaments. Filters. Thin beryllium window or borosilicate glass window is used to reduce inherent filtration. In addition, filters are used to remove unwanted high energy Bremsstrahl and X-rays. Grid. Scattered radiation is an important factor that reduces contrast in mammography. Scattered can be reduced by grid or air technique with breast compression. Heel effect. Heel effect causes the X-ray intensity is always higher at the cathode side. Position chest wall towards the cathode side and nipple towards the anode side. Compression pedal. Breast compression is required in all mammography examination to get good quality images. It ensures that tissue near the chest wall is not underexposed and tissue near the nipple is not overexposed. Breast compression has the following advantages. It reduces the overlapping of anatomy, spread out the tissue, reduces the thickness of the breast. Since compressed breast is thinner, scattered radiation is reduced and contrast resolution is improved. Compression brings the breast closer to the receptor, minimizes magnification and reduces focal spot blurring with lesser radiation dose to the breast. It also immobilizes the breast, minimizes motion related blur and reduces exposure time. Views of mammogram. It has two types of views: craniocaudal view, which is known as the standard views, and mediolateral oblique view, which is known as also the standard views. It can be represented as CC view and MLO view. Additional views may be taken in some cases, that are true lateral view, lateral medial oblique view, pedal compression view, magnification view and tangential view. Screen film system. Mammography is used with screen film and digital detectors today. The cassette, screens and films are specially made for mammography. Single emulsion film with single back screen is used. The cassette is made up of carbon fiber to have low attenuation. Gadolinium oxysulfide activated with terbium is used as a screen phosphor. Digital mammogram. Instead of a screen film system, detectors can be used for mammogram. Images can be captured directly or indirectly. In direct mammogram, X-ray falls directly on the photoconductor amorphous selenium, converts X-rays into digital signal. In indirect mammogram, X-ray falls in a scintillator, which is the cesium iodide or thallium, which emits light. This light is then detected by photodiode and converted into digital signals. Recent advances: digital breast tomosynthesis. It gives 3D picture of a breast using X-rays. It takes multiple X-ray images of breast from many angles. The breast is positioned similarly to the normal mammogram but with little compression. X-ray tube moves isocentrically in an arc around breast and takes about 15 images. This is how the case scenario of abnormal nodule and microcalcification breast looks like. That abnormal nodule is being diagnosed as breast cancer nodule. Other modalities for imaging breast are breast ultrasound. It is an imaging test that uses sound waves to look at the breast tissue. Breast ultrasound aids the assessment of abnormalities, which is directed by mammography. Determine vascularity. Characteristics of lesions may be cyst filled with fluid or solid tumor. Better evaluation of location and dimensions of lesion. MRI mammogram. It is the most sensitive method to detect the breast cancer. Coils are designed in such a way that the patient lies in prone position with breast dependent within the coil. This is how the patient has to be positioned. BIRATS. BIRATS is nothing but breast imaging, reporting and a database system, which is also known as BIRATS. BIRATS has some criteria to report. We'll see we'll see in the following. BIRATS 0, which is incomplete, which is nothing. BIRATS 1 is negative, it is not full of cancer. BIRATS 2 is benign findings. Benign findings is benign means it is suspected that the patient patient's tumor or lesion may be cancer or not. BIRATS 3 is suspicious benign. BIRATS 4 suspicious abnormality. If the stage of BIRATS 5 known case of malignancy. If stage of 6 BIRATS 6 known case of biopsy with proven malignancy. So these are the stages of BIRATS. Advantages and disadvantages of mammogram. Advantages: early detection of breast cancer, avoid unnecessary biopsies, reduce tissue superimposition, contrast enhancement of lesion, high depth and contrast resolution. Disadvantages: motion artifacts are more likely to occur because of slightly long exposure time.